Hi, and welcome to my channel. Today I will be talking about anemia. Anemia is defined as a reduction in the hemoglobin concentration of the blood below what is normal or what is expected for age and for sex. And these levels have been defined by the World Health Organization as hemoglobin concentration of less than 12 grams per dl in women and less than 13 grams per dl in men. Now, it is very important to note that anemia is not a diagnosis. You do not make a diagnosis of anemia. After taking a history from a patient, you cannot simply say my diagnosis is anemia. It is actually a presentation of an underlying condition. All right. So before we delve into the causes of anemia, let's quickly look at the life cycle of the red blood cell, which is the carrier of hemoglobin. So the cells are produced in the red bone marrow through a process called erythropoiesis, which simply means formation of the red cells. The red bone marrow is home to the precursors of the red cells, and these precursors eventually mature to become the mature red cells that we're familiar with. These mature red cells are then released into circulation. Now, in circulation, the red cell lives for about 120 days, so that's maybe 4 months. And at this point, after 120 days, the red cell is spent, it starts working, it just doesn't want to do anything anymore. Now, luckily for the red cell, when it passes through the spleen, there are macrophages in the spleen that are able to recognize that this red cell is spent. And when they recognize these red cells, they eat and digest the red cells. And items in the red cell that can be recycled are recycled. The items that can't be recycled are eventually excreted. Now that we have some understanding of the life cycle of the red blood cell, let us now talk about the causes of anemia. So first off, we have decreased production. Anything that affects the production of the red blood cell will ultimately lead to low hemoglobin levels. So think of it this way. If you want to grow a plant, three things are important: the soil, the seed, and the nutrients. So let's apply that here. Earlier, we said that the site of maturation of the red blood cell is the bone marrow. So in a situation where the nurturing environment of the bone marrow is impaired, as the soil, red blood cell production would be reduced. An example of this situation would be leukemias, where the white cells are expanding at an exponential rate and they end up depriving the other cell lines of nutrients and space to grow. Also, if there is damage to the precursor cells, that is the seed, by radiation for instance, red cell production would also reduce. So both situations we've talked about, we collectively would call them bone marrow disorders. Another cause of reduced production of red cells is nutritional deficiencies. Certain nutrients like iron and folate are required for proper development of the red blood cell, whether it's for heme production or for nuclear maturation. So we can understand how a deficiency of these nutrients would cause a reduction in red cell production. Let's look at a second cause of anemia, and that is blood loss. I believe it's quite understandable. Red cells are a constituent of blood, so when someone loses blood, they're losing red cells. Now, when we say blood loss, there's more to it than trauma. Think beyond the person who had an accident or person who had a deep cut. For instance, a patient with menorrhagia or a patient with a hookworm infestation. Both cases are causes of blood loss and they could also cause anemia. Finally, we have increased destruction, also known as hemolysis. So earlier we mentioned that the average red blood cell lifespan is about 120 days. However, in hemolytic anemias, the red cells are destroyed at a faster rate and the lifespan can be as short as 15 days. So the red cell destruction can be as a result of defects outside of the red cell. Examples are autoimmune hemolytic anemias where hemolysis is immune mediated. And also another example is microangiopathies where there's formation of blood clots in small vessels and ultimately there's lysis of red cells. In fact, in the microangiopathies, the blood films show fragmented red cells called schistocytes, and they look like pieces of a broken plate. Red cell destruction can also be due to defects within the cell. These defects could be in the membrane structure, hemoglobin structure, or the red cell enzymes. When talking about anemia, we could also talk about the severity of anemia. There are three levels: mild, moderate, and severe. In mild anemia, the patient has a hemoglobin concentration that is less than normal, which, as we said earlier, is 12 grams per dl in women and 13 grams per dl in men, but it is still greater than 11 grams per dl. In moderate, the hemoglobin concentration is greater than 7 grams per dl, but less than 11 grams per dl. And in severe anemia, the patient has a hemoglobin concentration of less than 7 grams per dl. Classification of anemia is done based on the mean corpuscular volume, simply written as MCV. MCV is the average volume of the red cells, and using the MCV, we can classify anemias as microcytic, normocytic, or macrocytic. In microcytic anemias, the MCV is less than 80 femtoliter, so it simply translates to small cell, and this is seen where there is defective hemoglobin synthesis. Examples are in iron deficiency anemia and thalassemias. In normocytic anemia, the MCV is between 80 to 100 femtoliter, so the MCV is normal. So this is a normal size cell. And it is seen in some hemolytic anemias, in hemorrhage, and in bone marrow disorders. In macrocytic anemia, the cell is greater than 100 femtoliter, so it's a large cell. And in this case, it can be classified as megaloblastic anemia if hypersegmented neutrophils are present. Some causes of megaloblastic anemia include folate deficiency and vitamin B12 deficiency. On the other hand, macrocytic anemia can be said to be non-megaloblastic if hypersegmented neutrophils are absent, and this is seen in liver disease or alcohol use. So, we've gone through the life cycle of the red cell, etiology and classification of anemia. Let's go over how a person with anemia may present. The person with anemia may be asymptomatic, meaning the person's low hemoglobin concentration is only found on routine testing, sometimes for something else. In other cases, the person may present with dyspnea, lethargy, exercise intolerance, and these occur because the reduced hemoglobin means reduced oxygen delivery to tissues. The person may also present with palpitations due to increased work rate of the heart, and chest pain because the working heart needs more oxygen than usual and the low hemoglobin concentration prevents it from getting that. On examination, the person is pale with tachycardia, which is the body's way of compensating. So apart from the general features of anemia, the patient would also present with features of the underlying cause. Some examples are pica, which is seen in iron deficiency anemia, glossitis, koilonychia, which means spoon-shaped nails and is seen in iron deficiency anemia as well. Jaundice would indicate underlying hemolysis. Leg ulcers may be seen in some hemolytic anemias as well. Petechiae can be seen in bone marrow failure because the failure would affect all the cell lines and the resulting reduction in platelet counts would cause petechiae. To investigate a patient with anemia, a very important test to be done is the complete blood count with differentials. From the result of this test, you need to take note of the reticulocyte count as well as the MCV. The reticulocyte count tells you whether or not the bone marrow is able to respond to the low hemoglobin levels. So if the reticulocyte count is low, it means that red cell production is affected. However, if it is high, it means red cell production is unaffected and you should think of hemolysis or blood loss. After looking at the reticulocyte count, the MCV can be used to further narrow down the etiology. Now, depending on the suspected cause based on your history and examination, other tests that would follow include iron studies in iron deficiency anemia, serum bilirubin, urine hemoglobin in hemolytic anemias, blood film, which can be used in hemolytic anemias as well as macrocytic anemias to determine the presence of hypersegmented neutrophils, and a bone marrow biopsy when the blood count shows pancytopenia. Just as investigations depend on the underlying cause, treatment also depends on the underlying cause. So in nutritional deficiencies, iron supplements, folate or vitamin B12 supplements would be given. In acute blood loss, a blood transfusion would be done. And in all cases of severe anemia, actually, a blood transfusion is required irrespective of the underlying cause. In bone marrow defects, a bone marrow transplant would be done. In sickle cell anemia, hydroxyurea is very useful. And in certain hemolytic anemias, which could be due to medications, removal of the offending agent is an important treatment modality. So in summary, anemia is defined as a reduction in hemoglobin levels, and it can be subdivided into microcytic, normocytic, or macrocytic. Patients with anemia may be asymptomatic or present with symptoms like fatigue or difficulty breathing, as well as symptoms of the underlying cause. An important investigation is the complete blood count with differentials, and other tests depend on the suspected cause. Treatment also depends on the underlying cause. Thank you for watching this video. If you enjoyed this video, feel free to like and subscribe to my channel.